Okay, we're going to go ahead and get started here. I imagine some more people will filter in at some point, but welcome everyone. Hope you had a nice lunch and enjoyed the Health and Resource Fair. The topic today is kind of an interesting one. We were trying to think outside of the box a little bit. This is the best and worst of epilepsy. So the session is generously sponsored by St. John Providence Health System, so we thank them for that. And I'm Russ Derry. I'm the Director of Education at Epilepsy Foundation of Michigan. And we're pleased to have as our panelist Dr. Amer Aboukasm, who is an adult epileptologist with St. John Providence Health System. Dr. Iqbal Allarakhia, who is a pediatric epileptologist, also with St. John Providence. Cassandra Emerson, who's an adult with epilepsy, who will be sharing her personal perspective, and Janet Weisz, who's a parent of a teen with epilepsy. So we have a wide array of perspectives that we'll be sharing today. And really, this is a different approach to this session. We're rather than focusing on one specific topic, we're going to cover a wide range of topics, things that probably don't come up in your typical conference. And I want to emphasize, as Dr. Smith emphasized earlier, the responses here are opinions. They are not facts, they're opinions. So every opinion will be different. It may be different than what you've heard before. So just take it as that. But I think there is still a lot of value in people sharing their opinions based on their personal experience, based on their professional and clinical experience. So with that in mind, let's get started. I'm just going to ask a whole bunch of questions, and our panelists will kind of share their thoughts on that. So first of all, let's start with what's the best piece of advice you've ever been given regarding epilepsy? So we can just go in general from left to right or right to left, depending on which way you're looking.
I think this question should be for the patient or
Okay.
the mom.
Go ahead. The best piece of advice that I was given when I was first diagnosed 5 years ago came from my neurologist, Dr. Marcus, and he told me this isn't going to be easy. He said it may take 3 years to find the right medicine to get everything under control, but if you work with me, then I'll work with you, because I was totally new. I never had seizures before. I'm 29 years old and started having seizures. So out of everything I've heard, that was the best advice. Take your medicine. If you work with me, I'll work with you. And I'm happy to say 5 years later, he has worked with me, and I'm down to 150 milligrams of meds a day. So yeah, I'm very happy.
Janet?
Probably the best piece of advice that I was given is, well, when my daughter was first diagnosed with epilepsy, the neurologist said our goal is no seizures, no side effects, which probably all of you that have epilepsy were told that. Mm-hmm. So we were used to doing what the doctor said, taking medication, and things would go as planned, and it really didn't for us because my daughter has refractory epilepsy. So it was really a struggle for us for the first, well, it's always been a struggle, but 6 months to a year when we realized that these seizures weren't going away. And I think my daughter got very frustrated, and I felt very guilty as a parent. And I can't even remember who told me this, but I remembered someone saying, you know, your goal probably may not be seizure control, but seizure management. And just that bit of information making us realize that what we need to do is we may need to live with epilepsy and with these seizures, but life still needs to go on, and you still need to enjoy life. And it took some of the frustration and the guilt, I think, off of my daughter and myself to realize that we're really doing everything we think we can, but we may not get these seizures under control, but it's something that we can learn to live with.
Mm-hmm. Great, thank you. And do either of you have something to share in terms of advice maybe you got from one of your mentors as you were growing up, or learning, not growing up, but learning the field and learning the trade?
When I make the diagnosis newly and announce the diagnosis to a new patient of mine, I reassure them that they're not alone in this boat, and this condition affects close to 1% of the population. So in a country of 300 million, we have probably close to 3 million living with this condition. And that's pretty reassuring, I think, and for patients and their family that it's a common condition, and we can handle it, and there's a treatment.
Yeah, the advice I give to patients when I first make a diagnosis, or if I see a patient who already has a diagnosis of epilepsy, is to tell them that they can live their life to the fullest, that it's a partnership between the physician and the patient and their family, they should be able to do most of the things they like to do, take part in sports and go out and have sleepovers and hold a job, and the goal is to try and minimize side effects and hopefully achieve seizure freedom. But if you can't, at least try the best control of seizures we can, which includes taking medications as recommended. So I think it's a partnership between the physician and the patient and the person with epilepsy or the family, and to make the most out of their life.
Okay, great. So on the opposite side, what's one of the worst aspects of having to live with epilepsy, either personally or in terms of the things that patients have reported to you?
Well, the worst part, there are several worst parts for me. The depression is still a huge one for me. The bouts of depression and getting treatment because you're epileptic and you do have depression, it's a little bit different than just going into somebody and saying, oh, I suffer from depression. That's been a struggle for me for the past 5 years. The depression has been crazy. One way I got through is because of the Epilepsy Foundation was the wellness program, the management to wellness program. That was extremely helpful. The other worst part is losing my independence, because there are certain places that I can't go, movies, clubs, because the lights affect my seizures, or people constantly calling to check on me, or they're worried about me if I'm gone too long. So that loss of independence and the depression are like the two absolute worst things to me, because I'm so used to getting up and going. So those are the two worst things.
Probably the worst thing about living with epilepsy for me as the parent is kind of the hypervigilance you always feel. I feel like ever since her diagnosis, you're always kind of on high alert. You feel like when your cell phone rings, it's like, is that, who's calling, who's telling me something? Yet, as I said previously, your life needs to go on. And I think the hardest part, if I could speak for my daughter, is probably that, she was diagnosed in her early teen years, is that, you want all of your kids to eat right, get your sleep, don't do silly things, but they need to realize that when you have epilepsy, those things are even more important. We know that lack of sleep and stress are triggers for her seizures, and it's hard to tell a teenager, don't stay out too late, you got to eat 3 meals a day, and to do all of those things and to still kind of want to be a normal teenager, I think.
I think the worst part of epilepsy, and I would concur with both speakers here, is the unpredictability of being able to tell when the seizure is likely to happen. And even when you control for the modifiable factors like making sure you get enough sleep, minimizing stress, it does put some constraint on your life. Like you have people checking up on you as a parent. You're always worried if your child will have a seizure. It may happen in a public place. So, even as I understand even a bigger concern for a person with epilepsy or a parent, but it's equally frustrating for a treating physician to have that element of unpredictability, which limits, even though you'd like to live your life to the fullest, there's constraint placed by the unpredictability of seizures. And the other things, is with the effects of the seizures themselves and the medications we prescribe, we have to admit that they work on the brain, so they have undesirable side effects sometimes. Most of the time people do fine, but sometimes they can have sedative, concentration, mood effects, which we cannot control for. It's very frustrating.
I shall add, probably I feel it through my patients. A lot of my patients, they are restricted from driving, and probably this dependence on others for mobility is a major it's the worst thing, I think, in a country where we don't have much of public transportation. Most our cities are not well equipped to accommodate individuals with epilepsy for transportation. And the second thing that I think is bad is the stigma associated with epilepsy. There's a lot of education need to be provided to the public to minimize the impact of epilepsy on those who are affected by it when it comes to discrimination and lack of knowledge of the public of what this condition is.
Thank you. Okay, so I'm going to put you all on the spot here. If you were trapped on a desert island, and you could only have one anti-seizure medication, what would it be and why?
I'm team clonazepam all day. I love clonazepam. My doctor put me on it. And he described it as the break in case of emergency seizure medicine in case I have more than 4 seizures in 30 minutes, which is sometimes very, very common for me. I love clonazepam because it just works so quick, and then I'm asleep and I'm good for a few days. So yeah, team clonazepam. I would have to take that one with me.
Thanks.
This is probably a better question for the neurologist to answer, but I guess, like I said, my daughter's been through many medications, but I would probably have to go with Keppra, only because that was the first medication that she's placed on and the only medication she's been on throughout her entire period that she's been on epilepsy, and seems to be the one that gives her the least side effects. Some of the other ones have made her very tired and very dizzy, groggy, and so just my uninformed opinion is probably Keppra.
If I was asked this question about 20 years ago, I would have said, and it's an old saying among the older generation neurologists, that if you ever had to go to a desert island, and if you could take one medicine, most people would overwhelmingly say phenytoin or dilantin. But we now have over 20 seizure medications, and each of them have their niche, and in each age group, and the side effects, and what are you trying to avoid? Any coexisting effects like headaches or depression or weight gain or weight loss. So every drug has its own niche, but I would tend to agree that probably Keppra has kind of been the most widely used medication, just because it's very simple to use. It's fairly clean. Even though, like any other medicine, sometimes it can cause irritability or sedation. But overall, it seems to have caught on quite a lot, and compared to all the newer drugs. So it's a biased opinion.
No, I would have to agree. Before I read the question, and I was sorry. And I agree that Keppra would be the drug, and for the simple reason it's a wide spectrum medication. It covers the genetic seizures, and it covers the partial seizures, the acquired seizures, and it works well, and it's easy to start. Side effects are reasonable, and especially for the childbearing age ladies, it's a safe drug to use during pregnancy. So every way you turn it, it's a good drug to use. Now, you need to be lucky and respond to Keppra. It's hit and miss, and sometimes roughly 70% of people respond to Keppra, and the rest are out of luck on it. So.
Okay, thank you. So related to anti-seizure medications, is there a common side effect that you would say is the most widely reported bothersome side effect, or I guess I should say the most bothersome widely reported side effect, the one that you hear the most complaints about, the side effect that really has the biggest impact on people's lives, and maybe might not be reason to immediately discontinue the medication, but would be enough to make people strongly consider switching? Or it doesn't have to be one either.
Most drugs are sedating, like everyone knows. There's no drug, no anti-epileptic drug that does not have sedation. There are a couple that are less sedating, and Keppra would be the one. And we work around those side effects by having patients start low and go slow in building up any of the antiepileptic drug intended to be used. Well,
So one vote for sedation. What are some of the other side effects that hear the most complaints about, I guess?
I would concur that the effects on the brain are the most concerning. Many times people are more concerned about the potential effect on the kidney or the liver or the skin or allergic reaction or weight gain or interaction with other drugs. But the side effect we most often encounter is the effect on the brain, which includes, sedation, effect on concentration, effect on the mood. And many times the effect is so subtle that you only realize that you have had that side effects when you come off the medicine. It's like if you turned off all the light. If I had a candle here, you would not notice the light of the candle. If I turned off all the lights, it would really light up the whole room. So that effect, it's like that. Even when it's not obvious, it's there. And it's only when you do careful testing, if you ask questions, or when you come off the medicine, you realize how much of the effect, which unfortunately that's the biggest effect you see.
For me, mood swings and memory loss. I can't stand it. I hate it. That's the worst side effect there could possibly be for the medicine. The mood swings, I'm already moody. If you know me, I'm already moody. But to have the Keppra rage, the Lamictal rage, the Tegretol rage, I've been on a lot of meds, y'all. Excuse me. They done put me through some changes. That is the most annoying. I've offended quite a few people while taking Keppra. It works great, but the mood swings are horrible. And the memory loss has brought me to tears a lot of days because it hurts to be young and you can't remember your name, or you can't remember what you just did 5 minutes ago, or you can't remember. I've had times where I've had a seizure, or it's just been a long day and I can't remember my kids' names. Or it has to be something specific for me to do to remember that it's Tuesday, to remember that it's Monday, because if it's just a regular day, I can't tell you what I did 5 minutes ago because I don't remember. So if there could be something that doesn't have the mood swings and doesn't have the memory loss, I'd be a very happy young lady. So y'all work on that. Y'all get that together for me. Hey.
Janet?
Well, listening to this panel today and to the rest of the speakers, I feel very fortunate that our daughter can take Keppra and doesn't have the mood swings and the problems with that, so that's good. I think the biggest side effect she's had is probably the sedating effect, the fatigue. I mean, during high school, when she was involved in one sport, and when she didn't have sports for that period of time, every other day she would come home and need to take a good 2-hour nap from school because she was just so exhausted from the medication. And there was 1 or 2 that caused a lot of nausea for her. So I think those were the biggest side effects for her.
Okay, thank you. So what's the most unusual seizure-related symptom you've ever either experienced or witnessed in a patient or heard of described? Because I think people are very familiar with the standard symptoms that you experience with a seizure, but what are some that may be lesser known?
Heard, yeah. I have one patient whose seizures were triggered by certain tunes and specifically by certain instrument played on a Beethoven
So
movements.
musicogenic
So
seizures.
musicogenic seizures. I had one of my patients had that. The strangest one I've heard, and it was published in the New England Journal of Medicine a few years ago, someone's seizure were triggered by hearing Mary Hart, who had a show on the TV in one of the chains.
Entertainment Tonight or
Entertainment
something like
Tonight,
that.
thank you. And the person's seizure were triggered by just hearing that voice and no one else. So that's pretty strange and amazing
Uncommon.
what the brain does.
Yeah, I mean, I've had quite a few unusual type of symptoms. An example is laughing or gelastic seizures, and they're often seen in young children who have a growth in the pituitary called a pituitary hamartoma, and those children will typically have a seizure during which laughing is a component of it. You can see that in other seizures as well, but so that's just an example of an unusual symptom you may experience.
Sandra?
What's unusual for me, thunderstorms. Thunderstorms, the lightning actually triggers seizures for me. And it's weird. It took a long time to catch on that that's what was causing it. So I have to take precautions when there are thunderstorms. The lightning actually triggers the seizure, and sometimes the sound of the thunder actually triggers a seizure. So my security squad, my children, Kendra and Olivia, are very overprotective of me during thunderstorms. And what was weird for my friend, she said, I was in a grocery store one time, I cracked jokes for 2 hours, and then all of a sudden my face went blank and I went into a seizure. But she said it was the greatest comedy show she ever got for free. So yeah, so it's just like, that's weird. The symptoms are weird.
Janet?
I don't really have anything unusual to report in terms of, seizures. My daughters are pretty the typical, and they're sparked by mainly stress and lack of sleep and.
Right. Okay. Yeah. Hot and cold water as triggers? Have you heard of that ever?
Not that I can recall specifically.
There's some literature from the third world. Apparently in India there's a famous type of a reflex epilepsy called bath epilepsy, where immersion in hot water in young children can trigger seizures. And these are reflex seizures, so exposure to hot water can sometimes trigger seizures. Yeah, a warm shower can trigger. It's more often seen in young kids, very young kids.
No,
Yeah.
I've had seizures where if it's too hot outside, they've triggered it. Now, seizures, for me, I have a safeguard. If it's like over 80 degrees outside or the humidity's over maybe 70%, I don't go outside because I know that's going to trigger a seizure. And I also have a double downside is that I have severe asthma. So excessive heat does trigger seizures. I do better in the wintertime, but there have been times where it's cold, and once again, the light is an issue for me. So going outside without sunglasses on, and there's like 9 feet of snow, looking at that snow and the sun's beaming off of it, it's triggered seizures before, and I'm 34, so if that helps your question out a little bit, yeah.
And I think really anything that is a stress of any sort, any kind of sudden change in the environment can be seen as a stress, and that it may be that it's not directly triggering it, but it's creating stress, which is then triggering the seizure. So, okay, yeah. So that it could be the negative emotion associated with that rather than the water itself. Okay, so this is a two-part question for the neurologists. I'd like you to describe your ideal patient. What are some of the factors or characteristics of an ideal patient? And similarly, what's your ideal neurologist? Cassandra's getting ready.
Our ideal patient would be the person who listens and follow our instruction and communicate with us. And we have a lot of our patients are in that boat. Some patients disappear on us, and they disappear and they show up like 18 months later when they ran out of medication and had their breakthrough seizure, which unfortunately it's too common. Most individuals, when they show up to the emergency room having seizures, it has been proven 70, 80, maybe 90% of the time there are individuals with epilepsy who have not been compliant to taking their medication. So yes, ideal patient is the one who's compliant and who listen and communicate with us.
I would concur with Dr. Aboukasm that the ideal patient is who takes their medication because I treat children, and whenever a teenager ends up in the emergency room, I always roll my eyes and I said, he probably did not take his medication, his or her medication. So, regardless of how much you do, until we have medications which work for the whole month or a whole week, we'd have to rely on at least being able to take medication on a daily basis. Otherwise, medicines will not work. And on the other, clearly having a well-informed patient, a well-motivated patient is the ideal one because they understand and are good partners in the treatment plan.
Oh, the ideal neurologist. Okay, where do I begin? If for those of y'all out there, I guess the first thing I would say, the ideal neurologist is one that does not says, it's all in your head. Where else is it gonna be? I mean, seriously, where else is it gonna be? And I say that because sometimes if it's hard to diagnose, which in my situation was a little hard to diagnose, the first thing out of a doctor's mouth is, it's all in your head. Well, I didn't know it was going to be in my foot, so could we not say that? A doctor, aside from that, see, I got y'all laughing, good. Aside from that, a doctor that you can easily communicate with, because sometimes it's intimidating to talk to your doctor about the symptoms that you may have, because certain doctors, nurses, hospitals, etc., feel like if it's not a textbook case of epilepsy, we as patients may feel like, I don't want to say anything because I don't want to be labeled as either crazy, or in my situation, I've gone through the ER and been accused of being a drug addict or being drunk, and that's offensive and that hurts. So to have a doctor that you can communicate with your symptoms and the medicine makes me feel like this, or can we try this in addition to my medicine? I would say a good neurologist would be somebody that you can communicate with. And if they're not bad to look at, that'd be great too. I mean, I like a nice looking doctor, No offense, but yeah, give me one of those too.
Janet?
Okay, speaking from a parent with a teen with epilepsy, I don't want her neurologist to be good looking. No. I think it's great. We have a wonderful neurologist that we really trust and look up to. And what we appreciate is that as our daughter has gotten older in her teen years, he does a wonderful job of speaking to her and asking her what her symptoms is, how are you feeling, what would you like to try moving forward, but then also realizes that she's not old enough necessarily to make these decisions independently, so then also kind of confers with us. So I appreciate a neurologist who has to walk that balance, working with older teens, that they have to work with the parents as well as the teen as they start getting into their adult years. I also really appreciate our neurologist because I feel like he is always willing to talk about new therapies, new medications, what can we try? I realize that would be different for somebody who had very well-controlled epilepsy, which we don't, so we do appreciate that. And then finally, we really appreciate our neurologist because his response time is impeccable. We can email him, and sometimes within an hour, he's writing back his response. So even though he has an army of probably thousands of patients, we always feel like we're given great attention, which is really nice.
And if I could just add one more thing real quick. A good neurologist, to me, it's important that the neurologist communicate with other doctors that you may have. In my case, I'm an unfortunate woman that the period comes, there are more seizures. I've been very fortunate that my neurologist communicates with my gynecologist, and they work together, even though they're two different health systems, they both work together to say, well, I'm trying this treatment, let's see what works. Working with other doctors, I think that's really important in treating epilepsy.
Right, that was mentioned earlier too. So what area of research do you think, oh, sorry, you had a question? Yeah? Okay, you had brain surgery not
Brain
quite
surgery.
2 years ago, okay.
That's right. Shortly after that, I did have one seizure, which very upsetting to me, but to me it was almost as if my body was getting used to the new position all over again.
Right.
I'm still on medicine, but for 8, 9 years, I've only been on 3 seizure medicines. And when I go see the doctor again next week, my feeling, and I think his, is he just wants to see how I'm reacting before he starts lowering the medication. Now, 2 other people I've spoken to, in fact, at one of these a couple years ago, they had the epilepsy as low enough manner to have the that work, the brain work. But I've been told by them too, after such a length of time, oh yeah, they have IDs maybe on themselves, or if it's like me, I carry stuff like wallet places to ID myself, or this is what I take. But they've been told, let's say, trying to think of a word. They don't have physical IDs. Even themselves, they don't wear them. They don't have them in their wallet. That they don't take any. They still on one med, of course, or I'm told you could get seizures all over again if you're not on one medicine. But they're not IDing themselves, even if you're driving. Oh, they know on paper what they got, or they would know their family, their friends know. But they haven't had that physical ID anymore. Like, that's okay now. They have it. It doesn't bother them so much. They just don't ID themselves. I don't know if I agree with that or.
Well,
not.
that's really ultimately a personal decision as to whether you want other people to know
Right.
about your epilepsy, and it's based largely on your seizure control and how likely it is you think that you'll have a seizure in public. And I think it's really different for everyone.
Okay.
Yeah, thanks. Okay, so what area of research would you say has the greatest potential to improve the lives of people with epilepsy? And then for Cassandra and Janet, what area of research would you like to see, or what, we talked about seizure detection and new treatments. What area do you think needs the most research and needs the most advances?
I think there are many areas of research. It's very difficult to single out one major area, but there are several different areas which are moving along in parallel. One is, for example, the genetics of epilepsy. In every year, we find new genes which are causative or contribute or predispose someone to a certain type of seizure. And the idea is ultimately that we would be able to use a drug which is specific. We'll be able to predict which drug is most likely to work with which type of patient. And that will be the ideal situation that there may be a long way off. Clearly, in terms of surgery for epilepsy, being able to refine the localization of seizures is being worked on, and every few years we see new ways to more closely define the area of seizures and to avoid areas which might be more important in terms of function. There are different new treatments for epilepsy, besides new medications in the pipeline, there's new methods for surgery, and there are electrical methods with stimulation and mapping. So there are many areas which are all moving together in tandem, and which gives us hope as to what the future is going to hold for us and for all of us here, both physicians and patients.
Dr. Allarakhia, you covered everything. I think the pharmacologic research has been advancing, and every couple of years we see a newer drug, and these drugs are getting better and more effective with less side effects. And we've been seeing those coming into our offices available to us to prescribe. And it's pretty impressive what the latest drugs have been offering us.
I would say the greatest area of research, yes, the drugs would be great, but I think the greatest area of research that will help people living with epilepsy is, I think, in the mental health area, because it's very hard to get help when you say you have epilepsy and you're trying to get help, whether it's the anger management due to the medicine or the depression. I think the greatest area of research that could help us is helping the general public, the doctors, or whoever works in the medical field, understand what people with epilepsy go through to better serve us, because there are differences you know, in what we go through versus somebody else that's just going through depression. There's another dynamic. There's an illness that is making us this way on top of an illness with depression. So I think the greatest research needs to come in, training the medical field better to relate to patients with epilepsy.
Janet, do you have any?
I think the other panelists did a great job. I don't think there's anything I can really add to that. Thank
Great.
you.
So what's the most common or most dangerous misconception about epilepsy that's out there? We mentioned stigma earlier. And then as a follow-up to that question, if let's say you had you could create a 20 to 30 second public service announcement that would air during the Super Bowl, what would be the message that you'd want to get out there to kind of combat that misconception?
The greatest misconception that I find is that you tell somebody you're epileptic and you have seizures, and the first thing they say is, what should I put in your mouth when you have a seizure? Nothing. It's not feeding time. I'm having a seizure. Don't put anything in my mouth. Don't do it. Just don't do it. That's the biggest misconception, and I hate it. And then it becomes a debate with people. Well, I did this back in the day. Well, you don't do that now. Don't put anything in my mouth. I might just bite your finger off or something else, or swing on you because my arms fly everywhere, so don't do it. If I had to do a 20 to 30 second PSA, I would say simply that I'm a daughter, I'm a sister, a mother, a friend, a barber, an artist, and I'm one of 33 million people in the United States that live with epilepsy, and I'm fabulous. And contact your local epilepsy foundation to find out more about epilepsy. I'm not contagious, I'm fabulous, and y'all just remember that, y'all fabulous too, okay?
Janet?
I think one of the biggest misconceptions, because, you know, obviously we didn't know much about epilepsy until our daughter was diagnosed, is that epilepsy means that you're going to have a convulsion. I think that's how most people envision it, something they've seen on TV. I think that can put a lot more fear in people than is really necessary, and I think that makes it very stigmatizing, you know, to have classmates, roommates, teachers even that are afraid to potentially have your child, your loved one in the same room with them. I also think, though, on the same respect, to think that all epilepsy is clonic tonic seizures is bad, because if you are someone who doesn't experience those types of seizures, they may say, well, you have epilepsy, but it's no big deal, right? You don't, you know, you're not having seizures, you're not convulsing, so, but they don't necessarily see the side effects that you have from medications, the way you have to restructure your life without driving, the fear that kind of goes through your mind, not necessarily fear, but it's always in the back of your mind, like, when's the next seizure going to happen? So for a public service announcement, unfortunately, I think the best way that people raise awareness is when major high-profile celebrity figures come out and say that they have a certain condition. So I'd like to see in the Super Bowl several public figures that are very high-profile that we don't know have epilepsy disclose that they have it, and basically have the football stadium then filled with the number of people percentage-wise that are sitting in that stadium that will be diagnosed with epilepsy in their lifetime, to see that it's hundreds of people that have epilepsy that we just don't even realize. And then also it would be nice to have Jerry Kill, since he's the football coach, be out there to kind of give his endorsement of it too.
Right, great, thanks. Any ideas?
I think I would tend to agree with the previous two speakers that the biggest misconception of epilepsy is that they are any different from the general population. When you see people with epilepsy, there have been famous figures in history who have excelled despite having epilepsy. You know, I know 5 physicians who have had epilepsy and still have epilepsy and take medications. You know, so people with epilepsy are no different from anyone else, and you know, showing famous figures who would come in the TV commercial would be a wonderful way of explaining that or showing to the world.
Anything to add?
All set.
Okay.
And then I have one more thing to
Sure.
add. There's one more thing that I don't like. When people say, funny, you don't look like you have epilepsy. I didn't know epilepsy was supposed to come with a complimentary look. You know, or geez, you look healthy. okay, once again, I didn't know that there was supposed to be a certain look to epilepsy. Did anybody else know that there was supposed to be a certain look to epilepsy? Yeah, you know, so that's one of the things too, the misconception. I guess you're supposed to look sickly, I don't know, but if we could just break that. Once again, we're all fabulous, so just because I'm sick doesn't mean I have to look, you know, sick, but yeah.
Right. So what services that are offered by Epilepsy Foundation or Epilepsy Foundation of Michigan do you find most valuable, either for yourself from having used it or for patients? And then what types of services that we're not currently offering do you think would be really needed and you'd like to see us offer?
The patients at the receiving end probably should answer this question.
Okay.
I can tell you my interaction with the foundation. I get patients referred to me. They move to the state. They don't know who to go to. And they call the foundation and they give them advice, who are the physicians and who's who in this field. And that's appreciated.
I think, you know, we have all appreciated that the foundation has been in the forefront for the advocacy of people with epilepsy and done a great job at the educational part. So I think, you know, I'm very appreciative of that.
I would say what was the name of the wellness program?
Progress Toward Wellness.
Okay, Progress Toward Wellness was excellent, where there was a phone call every 2 weeks with a coach, and you wrote out the things that you wanted to work on. And for me, Project to Wellness literally saved me from myself, because at that point in time, the depression due to the epilepsy was really hard for me to deal with. And I worked with Jessica for almost, 6 months? And it was a free program. It worked really well because I was able to start focusing on things I could do to help with my memory loss, my depression, and the weight. The weight gain was a huge issue for me. I gained 50 pounds in a year off of my meds, and just the hurtful things people would say. If I didn't do the Project to Wellness, I don't think I would have gotten through that as well as I did, and I'm very grateful for that. I think a program that is needed is more of like an outreach, especially in Detroit. When I talk to people and tell them I have epilepsy, they say, oh, I have a cousin who has epilepsy, or I have a friend who has epilepsy. More of an outreach so people know that there are services available, and also to train public service employees, bus drivers, police officers, because some people cannot tell the difference between a person who is drunk or epileptic. So I guess more of an outreach to the communities to let them know that, yes, there's help out there.
Great.
Yeah, we in our family think the Epilepsy Foundation of Michigan is wonderful. I can't imagine being back when Phil Gatone was speaking this morning and saying you find out you have a diagnosis and you go to the library and you're searching through books. You know, we called the Epilepsy Foundation of Michigan, and our daughter was in high school, it just started. So we have a shout out to Cindy Hanford, who is the education and advocacy specialist for the foundation, because she really guided us through how to navigate the school system, you know, how to deal with accommodations for our daughter, how to support her and make her still feel like normal and positive. So she really helped guide us and walk us through that. And the Epilepsy Foundation might have this, and or had it in the past, and we're just not aware of it, but probably kind of along what you were saying, Cassandra, is maybe some type of a online forum or support group where you could just, you know, email in or chat with somebody when you had a question or a concern. Like I said, our neurologist is great, and we email him a lot, but maybe there's nothing like speaking to someone else, I think, that's going through it that has epilepsy, and that's great. And we love the Learn and Share conference calls, too.
Right. And that's certainly the National Office of Epilepsy Foundation does have their e-communities,
Okay.
and they have forums as well, but we've heard a lot of people say they'd like a local
Yeah.
forum too as well. So, yeah, Jude?
For understanding the need for better pay for caretakers, better training for caretakers.
Okay.
'Cause it's not always the parents, not your whole life. So,
Right. Right, so public policy advocacy for better support financially and in terms of other services for caregivers, family caregivers, right? Okay. So in your years of dealing with epilepsy, either personally or professionally, what is one of the most interesting facts you've learned about epilepsy that maybe you didn't expect or you didn't know about before?
For me, I didn't know that changes in your hormones, if you're a woman, can trigger seizures. Some women, menopause can trigger epilepsy, or your menstrual cycle can trigger epilepsy. And boy, would I trade in, I would give anything just to have bad cramps instead of seizures every month. That was the most surprising fact. I didn't know that. And like I said, if anybody could get me to trade in, I would take the epilepsy away and just deal with really bad cramps from now on, because that's really hard to deal with. So that was the most interesting fact. And also learning from the Project Wellness, how other diseases and epilepsy link together, diabetes and epilepsy and asthma and epilepsy. I learned so much about how those diseases link in and how to manage all of it. So, yeah.
Janet?
I think, what was the question again, Russ?
An interesting fact that you've learned about epilepsy
Okay.
over the years.
I think it's probably just the sheer number of people that have or will be diagnosed with epilepsy in their lifetime. And prior to our daughter's diagnosis, I never would have guessed the kind of all-encompassing nature, I feel, of epilepsy. We have other family members with other chronic health conditions, which I don't want to discount those, but I feel like epilepsy there's so much, there's physical ramifications, psychological, emotional, which is true with a lot of other illnesses, but I guess the pervasiveness of the epilepsy was surprising to me.
It is surprising to me that in this day of age, with training new physicians and physicians dealing with masses, like in the emergency room, how often the diagnosis, the condition is misdiagnosed. I see a lot of patients, typically elder, coming to the emergency room having little confusion, and the diagnosis of stroke and TIA is universal. 100% of individual who hit the emergency room with this kind of presentation, which is the most common presentation of partial seizures, get the tag of TIA and plugged into a hospital with the workup for strokes and TIAs. And I spent tons of time talking to ER physicians and resident and other physicians that we work with in the hospital, trying to educate them. So I think we need to work on educating our physicians better.
And particularly in seniors too. My mother-in-law's husband had a seizure, but his wife missed the seizure. She didn't notice that part, but she saw the postictal period, and he had Todd's paralysis, so it was very similar to a TIA or a stroke. And so we called the ambulance, and then we learned, I asked her questions after the fact, and I said, well, so what was happening before he started this? And then she started describing, well, he was kind of not really answering my questions, and he started wandering around and then fumbling with these puzzle pieces, and I'm like, well, that was a seizure.
Mm-hmm.
And so she didn't recognize that. So I think it's true. A lot of times people, by the time they notice the person, they're already in that postictal period, and that can be confused with other things. Dr. Allarakhia, did you?
I would agree with Dr. Aboukasm and previous speakers that I think having all healthcare professionals, particularly the ones who are in the forefront of treating patients, like the emergency room physicians and primary care physicians and other specialties, being aware of symptoms of seizures and getting urgent and prompt treatment and looking for other things which can occur in tandem with epilepsy and managing them quickly rather than allowing them to drag on.
Right. So before we open it up for questions, I just wanted to close with one more question. Talked about the best and worst of epilepsy. So what's the best thing about living with epilepsy? And then also, what's the best thing about working in the field of epilepsy?
Working in the field of epilepsy is the most rewarding field when you see a patient who's been going through spells over and over, and you figure it out and treat them, and they come back to tell us no seizures. I just got a phone call from a lady yesterday after having seizure for like probably 40 or 50 years. I'm trying a new medicine on her. She takes always 2 or 3 drugs and average 10, 15 seizures a month. And yesterday she gave me the call, ecstatic about having had no more than 3 seizures 2 months ago. So her seizures stopped. Practically speaking, you cannot describe the ecstasy you feel hearing a person joy about having no seizures. Same thing with younger people, newly diagnosed, not knowing what they had for. So it's the most rewarding field I think I worked in. Okay. Sure.
Okay, thank you. Oh, sorry about that.
I think
Dr. Allarakhia?
I think one of the best things about working with and treating individuals with epilepsy is to get to interact with wonderful people who many times come and we work together and get good things done together. It's a partnership, and it's very important for it to be a two-way street where we speak to each other and we advise each other. And physicians don't know everything. It's many times we learn from our patients, and having that two-way conversation is very important about addressing concerns from both sides. So it's a partnership. It's very important.
The best part about living with epilepsy, one is that I get my bus pass for $17 a month instead of paying $50. So that's a really good thing. I'm saving money. The other best part of living with epilepsy is that I've learned to become fearless over the years. In the past 5 years, I've learned to stand up for myself, advocate for myself as well as others. I'm probably one of the most outspoken people you'll meet when it comes to epilepsy. I've learned to be driven because there's so many things when you say you have epilepsy, people think you can't do. And I've proven that I can. I've done more in 5 years than I've done probably within the last 10. I'm proud of myself for the things I've accomplished, releasing a CD and getting to perform so many different places while having epilepsy. I've learned to overcome things. I was at one point where I had to learn to walk and talk again because my seizures were just that bad. They affected my speech and my motor skills. I've become so driven and so fearless that I don't care if you don't speak to me because I have epilepsy or you don't want to be around me, so what? I'm still good with or without you. So I would say the best thing is that I've learned to become a better me.
Sometimes it's hard to think about something good from having epilepsy, but I think for my daughter and our family, sometimes teenagers can be very egocentric, and I think that epilepsy has kind of opened her up and opened us up to realize that everybody's got something going on in their life, whether it's epilepsy or some other condition or something. I think it's made her a much more compassionate person and made us so appreciative of this conference, all those people out there that we're not alone, and to realize that, like Cassandra was saying, you really can do just about anything, but it may take a little bit more effort.
Yeah.
Excellent, thank you. All right, well, I want to thank all of our panelists for your great input and sharing so much, and wanted to open it up for questions for a few minutes. We've got about 5 minutes left. Yeah, Bruce? If you can wait until the microphone gets to you.
Yeah, this is a question I was going to raise if there had been time before lunch, and it's not about anything relating to the illness or physical aspect of epilepsy, but for a more technical point of view and thinking of what we were saying about one of the major challenges, not being able to legally drive after 6 months from a seizure. We've all heard about how there's a lot of advances in automotive technology, and the time of the driverless car does not seem to be very far off in the future. I'm wondering, and maybe Russ, you might be as well equipped to try and answer this as anybody. Has the Epilepsy Foundation nationally or any other group you are aware of been able to make any contact with automotive manufacturers or with the National Traffic Association, the Safety Association in that regard, so that the day may come where people who have epilepsy will be able to drive more safely, and equally important, some kind of way that they might be able to be forewarned so that when they're driving, they're not going to have a seizure and cause an accident.
Right. I think that's an excellent idea, and I think you should contact the national office because they're looking for ideas like that to support through their research projects. So, and they're always looking for partners too. So if they could have some initiative to work with the auto industry and try and contribute to advancing that technology more quickly, because that's really their goal, is to get things to market more quickly. They don't want cures for 50 years in the future. They want stuff that will help people now. So I'd be happy to work with you to get that message to the national office. Oh no, but you have a good idea, and I think that is a type of technology that many people haven't thought, and like this would have an application for people with epilepsy. And if the industry knew more that it's not just, a benefit to the general population, it has a specific value for people with epilepsy and people with other disabilities who can't drive. So, yep.
Hi. Recently, my son was in the hospital, and the first thing when the neurologist walked in, oh, he doesn't take his medicine, he's been here before. What do we, as a parent or a patient, when the doctor totally just like blew it off right away, he's still having seizures, the doctor's like, well, there's not much we can do, he don't take medicine, and walks out of the room. What do we do to either get these doctors better educated or to stop that attitude?
What I've done in the past, especially I had an incident where, like I said, I went to the ER. Oh, you don't take your medicine? Yes, I do. There are certain meds that don't show up in your bloodstream when it's drawn, but you do take your medicine. I've been accidentally overdosed before because they thought I didn't take my medicine and I took it. I've been, like I said, accused of being a drug addict or whatever. What I did, I made sure I kept my paperwork, and whoever that doctor was, I filed a nice little complaint. You have to speak out. You have to complain. And when you complain, then things get done. I would say keep that doctor's name and, let them go out the room and ask for another doctor to come in, because that's disrespectful, it's rude, and to me, it's just outright rude. And if you don't want to take the time to really go step by step and see why these seizures are happening, sometimes the meds may not work anymore. Sometimes it's just one of those things that you took your meds and it doesn't work. But if you feel like I didn't take my meds and walk out the room, you can keep walking. Get me another doctor. Meanwhile, give me your name, and I'm going to write you up, and I'm going to talk to your supervisor and see how you like that. So complain. It works every time.
Thank you. And Dr. Aboukasm, I'd like to speak to you at the end of this session, please.
Sure.
Thanks.
I think we're very fortunate in Michigan that we have 6 comprehensive epilepsy programs. So there always is a choice. And I think your first choice should always be to talk with your neurologist and make sure you open up the lines of communication, let them know what you're dissatisfied with, let them know. But then, if you don't see a change, then there are other options. So, all right, well, time is up, unfortunately. We do have a 10-minute break, so if you're able to track down any of our speakers during that point, you can certainly talk to them. If everyone can exit through these doors on the right, please, that would be great. Thanks, everyone.